But because the story most seniors have been told about joint pain after 60 is dangerously incomplete, and the incomplete story is costing them their mobility, their independence, and their quality of life. My name is Dr. Shan Clark, and today I want to tell you the full story. Section 1, what is actually happening in your joints. Let me start with the biology, because understanding what is actually happening inside your joints changes everything about how you approach the pain. Most people think of arthritis, specifically osteoarthritis, which is by far the most common form in seniors, as a simple wear and tear problem. The cartilage in your joints has worn away from decades of use. Bone is now rubbing against bone, and the pain is the inevitable result of that friction. That picture is partially correct, but it is critically incomplete. Here is what the research has revealed over the last 2 decades that changes the entire conversation. Osteoarthritis is not simply a mechanical problem. It is an inflammatory disease. The cartilage breakdown is real, but it does not happen in isolation. It happens in an environment of chronic, low-grade inflammation. The same systemic inflammation we have discussed in earlier videos in connection with heart disease, kidney disease, and brain aging. When inflammation is present in a joint, it activates enzymes called metalloproteinases that actively break down cartilage. It stimulates the synovial lining of the joint, the tissue that produces joint fluid, and lubricates movement to produce inflammatory compounds called cytokines. Those cytokines cause pain, cause swelling, cause the destruction of more cartilage, and produce more inflammation. It is a self-reinforcing cycle. And here's the critical implication of this understanding. If osteoarthritis is driven by inflammation, then the same dietary patterns, lifestyle choices, and daily habits that drive inflammation throughout the rest of your body are also driving the destruction of your joints. The same processed foods that are damaging your kidneys and your heart are feeding the inflammatory cycle in your knees and hips. The same sedentary lifestyle that is weakening your cardiovascular system is allowing the muscles that support your joints to atrophy, putting more stress on cartilage that is already compromised. The same chronic dehydration that is stressing your kidneys is also reducing the production of synovial fluid, the natural lubricant inside your joints that allows surfaces to move smoothly against each other. This is not just bad news. This is actually profoundly good news, because it means that joint pain after 60 is not simply an inevitable consequence of having lived in your body for 6 decades. It means there are real, modifiable drivers that you have genuine power to address. And that is exactly what this video is about. Section 2, the 6 things most seniors get wrong about joint pain. Before I give you the 6 science-backed strategies that actually work, I want to address the 6 most common mistakes I see seniors making when it comes to joint pain. Because sometimes understanding what not to do is just as important as knowing what to do. Mistake number 1, resting too much. This is perhaps the most counterintuitive thing I will say today. When joints hurt, the instinct is to rest them, to stop moving, to protect them from further damage. But the research is unequivocal on this point. Prolonged rest immobility makes joint pain significantly worse over time, not better. Here is why. Cartilage does not have its own blood supply. It receives its oxygen and nutrients through a process called diffusion. Nutrients are essentially squeezed into the cartilage when the joint is compressed by movement, and waste products are squeezed out when the pressure is released. Movement is how cartilage feeds itself. When you stop moving, cartilage is deprived of this nutrient delivery system. It becomes less healthy, it degrades faster, and the muscles that support the joint weaken from disuse, which means more stress falls directly on the joint surface itself, accelerating the very damage you were trying to prevent. The Arthritis Foundation, after reviewing decades of research, states clearly that regular physical activity is the single most effective non-pharmacological intervention for osteoarthritis. more effective than any supplement, more effective than most medications. Movement is medicine for arthritic joints, not rest. Mistake number 2, relying primarily on oral NSAIDs for daily pain management. We talked about this extensively in our last video. Ibuprofen and naproxen taken daily carry serious risks for seniors, including kidney damage, gastrointestinal bleeding, and cardiovascular events. And they treat the pain without addressing the underlying inflammatory process that is driving cartilage destruction. They mask the problem while the problem continues and worsens underneath. Mistake number 3, believing that weight is just a number when it comes to joints. I say this with compassion and without judgment because weight is a sensitive topic and I know many seniors struggle with it despite genuinely trying. But the biomechanics here are important and worth understanding clearly. Every pound of excess body weight adds approximately 4 pounds of pressure to the knee joint with each step you take. That is not a metaphor. That is the mechanical reality of how force is transmitted through the human body during walking, which means that 10 pounds of excess body weight adds 40 pounds of pressure to your knees with every single step. Across the thousands of steps you take each day, that accumulates into an enormous additional load on cartilage that is already compromised. Research from Johns Hopkins University found that losing just 1 pound of body weight reduces the force on the knee joint by 4 pounds, and that losing 10 pounds can result in up to a 50% reduction in knee pain for overweight seniors. With osteoarthritis, 10 pounds, 50% pain reduction. That is a profound return on a relatively modest effort. Mistake number 4, ignoring the gut-joint connection. This one surprises almost everyone. But emerging research has established a clear connection between gut microbiome health and joint inflammation. An unhealthy gut microbiome, one dominated by inflammatory bacteria rather than beneficial ones, produces compounds that enter the bloodstream and promote systemic inflammation, including in joint tissue. Multiple studies have now found that people with osteoarthritis have measurably different gut microbiome compositions than people with healthy joints. The foods that damage your gut, ultra-processed foods, refined sugars, artificial sweeteners, excessive alcohol also feed joint inflammation. And the foods that support gut health, fiber-rich vegetables, fermented foods, legumes, polyphenol-rich fruits also reduce joint inflammation. Your kitchen is connected to your knees in ways that most senior health advice never mentions. Mistake number 5, taking supplements that sound good but lack evidence. The joint supplement industry is worth billions of dollars annually. And many of the products marketed most aggressively to seniors have very weak or inconsistent clinical evidence. I want to specifically mention glucosamine here because it is one of the most widely used joint supplements among seniors. In a major study published in Nature Metabolism in 2026, analyzing records from more than 65,000 patients, found something concerning people with early memory changes who took glucosamine were 25% more likely to progress to full Alzheimer's disease than those who did not. This finding is an association, not confirmed causation. The research is still developing, but for seniors who are already managing cognitive concerns, this is an important conversation to have with your physician before continuing glucosamine supplementation. I will tell you which supplements do have meaningful evidence shortly. Mistake number 6, accepting a diagnosis of bone on bone as a death sentence for your joints. The phrase bone on bone is one that many seniors hear from their orthopedic surgeons, and it is consistently interpreted as meaning that nothing can be done short of joint replacement surgery. But research has consistently shown that the degree of structural damage visible on imaging does not reliably predict the degree of pain or functional limitation a person experiences. Some people with severe imaging findings have minimal pain. Some people with relatively mild imaging findings have severe, debilitating pain. What this tells us is that pain is not purely structural. The inflammatory environment, the strength of surrounding muscles, the person's activity level, their body weight, and their nutritional status all play significant roles in determining how much pain they experience regardless of what the imaging shows. This means that even if you have been told your joints are bone-on-bone lifestyle, dietary and movement interventions can still produce meaningful improvements in pain and function. The research supports this clearly. Section 3.6 science-backed strategies that actually reduce joint pain after 60. Now let me give you what you came for. 6 specific evidence-based strategies that the research consistently supports for reducing joint pain, slowing joint damage, and restoring mobility in seniors over 60. Strategy number 1, move in water. Aquatic exercise has the highest level of evidence of any physical therapy approach for osteoarthritis of the knee and hip. Multiple systematic reviews and clinical trials have confirmed it. Here is why it works so well. Water provides buoyancy that reduces the gravitational load on your joints by up to 90% compared to land-based exercise. Your joints can move freely and comfortably through a full range of motion without the pain-provoking impact of walking or other weight-bearing activities. At the same time, water provides gentle resistance that strengthens the muscles surrounding your joints. Stronger muscles mean better joint stability. Better joint stability means less abnormal stress on cartilage. Less stress on cartilage means slower progression of damage and less pain. Swimming laps, water aerobics classes, and even simply walking back and forth in a pool are all highly effective. Many community centers, YMCAs, and senior centers offer heated pool facilities specifically for this purpose. If you have access to a pool, I urge you to use it. For joint pain specifically, it may be the single most effective thing you can do. Strategy number 2, Tai Chi. This one has been studied more rigorously for joint health than almost any other movement practice, and the results are consistently impressive. A major clinical trial published in the Annals of Internal Medicine compared Tai Chi directly to physical therapy for knee osteoarthritis, considered the gold standard of conservative treatment. The result? Tai Chi produced comparable pain relief and functional improvement to physical therapy, and it produced greater improvements in depression and psychological well-being, which matters because chronic pain and depression are deeply intertwined in seniors. Why does Tai Chi work so well for joint pain? It combines gentle, flowing movement with weight shifting and balance training. It strengthens the muscles of the legs and core without high impact load on the joints. It improves proprioception, the body's sense of where its joints are in space, which reduces the risk of falls and abnormal joint stress. And it reduces the cortisol and inflammatory markers associated with chronic stress, which directly contributes to joint inflammation reduction. Classes are available in most communities through senior centers, YMCAs, and online. Many are specifically designed for seniors with mobility limitations. You do not need to be flexible, coordinated, or particularly mobile to start. It meets you where you are. Strategy number 3, anti-inflammatory eating. We have discussed inflammation throughout this entire video series, and the dietary pattern with the strongest evidence for reducing systemic inflammation and therefore joint inflammation is a Mediterranean-style eating pattern. Specifically for joint pain, the foods with the most consistent evidence include the following: fatty fish, salmon, mackerel, sardines 3 times per week. The omega-3 fatty acids, EPA and DHA, have been shown in multiple clinical trials to reduce joint inflammation and stiffness to a degree comparable to low-dose NSAIDs without the kidney and cardiovascular risk. The Arthritis Foundation specifically recommends omega-3 rich fish as a first-line dietary intervention for joint pain. Extra virgin olive oil, 1 to 2 tablespoons daily. The oleocanthal compound we discussed in our longevity foods video inhibits the same inflammatory pathways as ibuprofen. Research from the University of Athens found that regular olive oil consumption was associated with significantly lower rates of rheumatoid arthritis. Colorful vegetables and fruits, particularly berries, cherries, leafy greens, and bell peppers. These deliver antioxidants and polyphenols that neutralize the free radicals driving joint inflammation and cartilage oxidative damage. Turmeric with black pepper, as we discussed in detail in our longevity foods video, has shown in clinical trials to reduce arthritis pain as effectively as ibuprofen in some head-to-head comparisons. Half a teaspoon daily with black pepper and a fat source is the practical target. And on the other side of the equation, the foods most strongly associated with increased joint inflammation that I urge you to significantly reduce: refined carbohydrates and added sugars, which spike inflammatory markers; processed vegetable oils high in omega-6 fatty acids; and ultra-processed foods of all kinds. Strategy number 4, heat and cold therapy, used strategically. This is not glamorous, but it is effective, accessible, and completely free. Heat increases blood flow to stiff, aching joints. It relaxes surrounding muscle tension. It improves the viscosity of synovial fluid, making it flow more freely within the joint. Morning stiffness, that characteristic joint pain and rigidity that many seniors feel in the first 30 to 60 minutes after waking, responds particularly well to heat. A warm shower or bath first thing in the morning, a heating pad applied to stiff joints for 15 to 20 minutes, or warm water immersion before exercise all reduce morning stiffness and make movement considerably more comfortable. Cold therapy works differently. It reduces active inflammation and numbs acute pain signals. It is most effective after exercise or physical activity, or during flare-ups of more acute joint swelling and heat. An ice pack wrapped in a thin cloth applied for 15 minutes after activity or during a flare reduces the acute inflammatory response and provides meaningful pain relief without any pharmacological risk. The most sophisticated approach is alternating heat and cold. 10 minutes of heat followed by 10 minutes of cold, repeated 2 to 3 cycles. This creates a pumping action in the blood vessels around the joint that flushes inflammatory compounds out and brings oxygen-rich blood in. The Arthritis Foundation recommends this approach specifically for chronic joint pain management. Strategy number 5, topical diclofenac. I mentioned this in our medication video, but it deserves its own moment here because it is one of the most clinically underutilized joint pain treatments available to seniors. Diclofenac gel, sold under the brand name Voltaren, now available over the counter, is a topical NSAID applied directly to the skin over the painful joint. It penetrates the skin and delivers anti-inflammatory effect locally to the joint tissue beneath. The critical advantage over oral NSAIDs, which we established, carry serious kidney, gastrointestinal, and cardiovascular risks for seniors, is that topical diclofenac produces far lower systemic blood levels. The anti-inflammatory effect happens where you need it, with dramatically less of the drug reaching your kidneys, your stomach lining, or your cardiovascular system. Multiple clinical trials have confirmed that topical diclofenac is effective for knee and hand osteoarthritis pain. The European League Against Rheumatism guidelines recommend it as a first-line pharmacological treatment, specifically for seniors, preferring it over oral NSAIDs, precisely because of its better safety profile in this age group. If you are currently taking oral ibuprofen or naproxen daily for joint pain, ask your doctor whether switching to topical diclofenac could give you comparable pain relief with significantly less systemic risk. Strategy number 6, vitamin D optimization. We discussed vitamin D at length in our lab numbers video, but its specific role in joint health deserves emphasis here. Vitamin D receptors are found in cartilage cells, chondrocytes, and in the synovial tissue of joints. Vitamin D plays a direct role in cartilage metabolism, in regulating the inflammatory environment within joints, and in maintaining the bone quality beneath the cartilage surface that supports joint function. Multiple studies have found that people with low vitamin D levels have faster progression of knee osteoarthritis and report more severe joint pain than those with adequate levels. A study published in the journal Arthritis and Rheumatology found that seniors with vitamin D deficiency had significantly higher levels of inflammatory markers in their joint fluid, linking low vitamin D directly to the inflammatory joint environment that drives cartilage breakdown. And as we established in our lab numbers video, between 40 and 70% of seniors have insufficient vitamin D levels. This is not a rare problem, it is a majority problem. Getting your serum 25-hydroxyvitamin D tested and correcting any deficiency through supplementation under your physician's guidance and appropriate sun exposure is a meaningful intervention for joint health that is frequently overlooked. Section 4, the joint pain daily routine. Let me give you a practical daily structure that incorporates everything we've discussed in a way that is realistic and sustainable. Morning, start with heat. Before you get out of bed, if your joints are stiff, spend 10 to 15 minutes with a heating pad on your most affected joints. Or go directly to a warm shower and let the heat work on your body before you start asking it to move. This reduces morning stiffness significantly and makes your first movements of the day considerably more comfortable. After warming up, move gently. Gentle range of motion movements while seated or standing slowly, bending and straightening your knees, rotating your ankles, moving your fingers through their full range, stimulates the synovial fluid production that lubricates joint surfaces and initiates the nutrient delivery process that cartilage depends on. Mid-morning or early afternoon structured exercise. This is when you schedule your water exercise, your Tai Chi class, your walking, or whatever movement modality works for your situation. The goal is at minimum 30 minutes of gentle, joint-friendly movement that elevates your heart rate modestly. If you are starting from a place of significant pain and very limited mobility, start with 5 minutes. Then 10. Build slowly. Any movement is better than none, and consistency over time produces remarkable cumulative benefit. After exercise, apply cold if needed. If the exercise joints feel warm, swollen, or more acutely painful, after activity, a 15-minute ice pack application reduces the post-exercise inflammatory response and prevents it from accumulating into the kind of flare that discourages people from continuing to exercise. With meals, eat anti-inflammatory foods. Every meal is an opportunity to either feed or fight joint inflammation. Choose fatty fish over fried chicken. Choose olive oil over processed seed oils. Choose berries and vegetables over pastries and crackers. Use turmeric and ginger in your cooking consistently. Before bed, consider a warm bath. Soaking in warm water for 15 to 20 minutes before bed with Epsom salts, which deliver magnesium transdermally and may reduce muscle cramping and stiffness, both improve sleep quality and reduces overnight joint stiffness. Seniors who implement this consistently report meaningfully better joint comfort upon waking the following morning. Let me bring this home. 60% of seniors over 60 live with chronic joint pain, and the vast majority of them have been told either directly or implicitly that this is simply the price of aging, that there is little to be done beyond managing the pain with medication and accepting the gradual loss of mobility. The science says otherwise. Osteoarthritis is an inflammatory disease. Inflammation is modifiable through movement, through diet, through the specific strategies we discussed today. The inflammatory environment in your joints can be meaningfully changed. Cartilage breakdown can be slowed, pain can be reduced. Mobility can be preserved and in many cases restored. Not perfectly, not instantly, but meaningfully and progressively with consistency over weeks and months. You do not have to stop walking. You do not have to give up gardening. You do not have to miss the moments that matter because your knees or hips have decided that movement is not worth the pain. You have more power over your joints than you've been told. Start using it. I'm Dr. Shan Clark. If this video gave you a new perspective on your joint pain, please share it with someone you care about who is struggling with the same thing and who has been told that there is nothing more to be done. Subscribe for a new video every week, honest, research-backed, senior-specific health content that gives you the full story. And leave a comment below telling me which of these 6 strategies are you going to try first. Take care of yourself. I'll see you next week.